What is the mortality rate for children infected with measles? A. 1 in 20. B. 1 in 2000. C. 1 in 50. D. 1 in 10,000. E. 1 in 500. The answer is E. 1 in 500. Measles, while generally only a moderately severe disease, is fatal in 1 out of every 500 children who contract the virus. Genital herpes is caused by what virus? A. Herpes simplex virus type 1. B. Herpes simplex virus type 2. C. Herpes simplex virus type 1 and 2. D. Human herpes virus 7. The answer is C. Herpes simplex virus type 1 and 2. Genital herpes is most frequently associated with herpes simplex virus 2, HSV2, while herpes simplex virus 1, HSV1, has been associated more often with oral herpes, cold sores. However, new evidence suggests that both viruses can live in either location. HSV1 can spread to the genitals and cause genital herpes, while HSV2 can be spread to the oral mucosa to cause cold sores. Adult complications from cytomegalovirus, CMV, are most common in what population? A. Teens. B. The elderly. C. Athletes. D. Immunocompromised individuals. The answer is D. Immunocompromised individuals. In adult populations, cytomegalovirus poses the greatest risk to immunocompromised individuals, such as people on immunosuppressive drugs or in HIV patients who have developed AIDS. In pregnant people, CMV generally does not pose a risk to the mother, but rather to the fetus. Athletes and teens that are not immunocompromised often will have mild or unnoticeable symptoms when infected with CMV. What type of virus is molluscum contagiosum? A. Retrovirus. B. Adenovirus. C. Poxvirus. D. Herpesvirus. The answer is C. Poxvirus. Molluscum contagiosum is a form of poxvirus. Poxviruses are a family of enveloped group 1 double-stranded DNA viruses that includes molluscum contagiosum virus, smallpox virus, vaccinia virus, and monkeypox. Which of the following class of viruses is responsible for all warts, including plantar warts, genital warts, flat warts, and common warts? A. Epstein-Barr virus. B. Herpes simplex. C. cytomegalovirus. D. Human papillomavirus. The answer is D. Human papillomavirus. All forms of warts are caused by the virus HPV, or human papillomavirus. In addition, HPV is the cause of a variety of dysplasias, including cervical dysplasia, vulvar dysplasia, and oropharyngeal cancer. None of the other viruses listed are associated with warts of any kind. Over 70% of cervical cancers are associated with which two strains of human papillomavirus, HPV? A. 6 and 11. B. 16 and 18. C. 31 and 33. D. 2 and 7. The answer is B. 16 and 18. While HPV strains 31 and 33 have been associated with genital malignancies, more than 70% of cervical dysplasia is associated with HPV strains 16 and 18. Strains 6 and 11 are associated with genital warts, while 2 and 7 are associated with common warts. %90 of cases of Condylomata acuminata, genital warts, are caused by what two strains of human papillomavirus, HPV? A. 6 and 11. B. 51 and 52. C. 42 and 43. D. 30 and 54. The answer is A. 6 and 11. While all of the strains of HPV may cause Condylomata acuminata, 90% of all cases of genital warts are caused by just two strains, 6 and 11. All of the following are forms of herpes virus except A. Varicella zoster. B. Herpes simplex. C. Epstein-Barr virus. D. Rotavirus. The answer is D. Rotavirus. There are more than 130 types of herpes viruses. Of those, 8 are known to infect humans. Some of the more common examples are herpes simplex 1 and 2, varicella, zoster, Epstein-Barr virus, and cytomegalovirus. Less common viruses include human herpes virus 6, human herpes virus 7, and Kaposi's sarcoma-associated herpes virus. Rotavirus is not a herpes virus, rather, it is a double-stranded RNA virus in the Reoviridae family. Human papillomavirus, HPV, is associated with increased risk of which of the following cancers? A. Oropharyngeal cancer. B. Anal cancer. C. Vulvar cancer. D. All of these are correct. The answer is D. All of these are correct. Human papillomavirus has been associated with several forms of cancer, including cancers of the cervix, vulva, anus, and oropharynx. It is also associated with penile and vaginal dysplasias. Which of the following is the microbe most frequently associated with the common cold? A. Influenza. B. Human coronavirus. C. Rhinovirus. D. Adenovirus. The answer is C. Rhinovirus. Rhinovirus, a type of picornavirus, is implicated in up to 50 to 80% of cases of the common cold. Other less common causes include human coronavirus, 15% of cases, influenza, 10%, and adenovirus, 5%. Which of the following microbes is the most common cause of infectious vomiting and diarrhea in infants and small children? A. E. coli bacteria. B. Giardia parasite. C. norovirus. D. rotavirus. The answer is D. rotavirus. The majority of infectious vomiting and diarrhea in infants and young children is viral in origin, with the most commonly implicated virus being rotavirus. Norovirus is another common cause of viral gastroenteritis in individuals of all ages, though it is not as common in young children as rotavirus. Zika virus is primarily dangerous to which of the following populations? A. Young children. B. Unborn fetuses. C. Pregnant women. D. The elderly. The answer is B. Unborn fetuses. In most children and adults, Zika virus causes a mild fever characterized by myalgia, fatigue, and headache. The population most at risk for serious complications from the disease is unborn fetuses. Exposure to Zika virus before birth has been associated with microcephaly, a frequently fatal disorder of abnormal skull and brain development. Which of the following are structurally similar to the influenza virus? A. Togaviridae. B. Retroviridae. C. Coronaviridae. D. Rhabdoviridae. E. Paramyxoviruses. The answer is E. Paramyxoviruses. Each of these viral families or groups has an RNA genome and envelope. The paramyxoviruses are structurally the most closely related to influenza, since both are negative sense RNA viruses and many of the paramyxoviruses contain neuraminidase and hemagglutinin. The viruses in the Togaviridae and Coronaviridae families differ from the influenza viruses in that they have a positive sense RNA genome. Viruses in the Rhabdoviridae family, which includes the vesicular stomatitis virus and the rabies virus, are bacilliform negative stranded RNA viruses. Paramyxoviruses possess hemagglutinin and neuraminidase that are present on the A. Golgi bodies. B. Endoplasmic reticulum. C. Nucleus. D. Same spike. E. Different spikes. The answer is D. Same spike. Paramyxoviruses possess hemagglutinin and neuraminidase that are present on the same spike. This is in contrast to the orthomyxoviruses that possess hemagglutinin and neuraminidase on different spikes. These enveloped, pleomorphic, and ssRNA viruses cause respiratory infections by droplet nuclei or contact transmission. These belong to the orthomyxovirus group and are called what? A. Respiratory syncytial virus. B. Influenza virus. C. Lentiviruses. D. Parainfluenza virus. The answer is B. Influenza virus. The influenza virus is a member of the orthomyxovirus group and is an enveloped ssRNA virus. Lentiviruses are a group of retroviruses which include HIV-1, parainfluenza virus and respiratory syncytial virus, RSV, belong to the paramyxovirus group. Which of the following is the most common cause of hand, foot, and mouth disease? A. Herpes simplex virus. B. Lassa fever. C. Parainfluenza virus. D. Rotavirus. E. Coxsackie virus. A. The answer is E. Coxsackie virus. A. Hand, foot, and mouth disease is a vesicular exanthem caused by Coxsackie virus A16. It is characterized by ulcerating vesicles on hand, foot, mouth, and tongue along with mild fever. The disease subsides in a few days on its own. Adenoviruses are transmitted by A. Aerosol droplet. B. Fecal oral. C. Mosquito bite. D. Tick bite. E. Direct inoculation of conjunctive bitonometers or fingers. The answer is A. Aerosol droplet. Adenoviruses are transmitted by aerosol droplets. They are not transmitted by fecal, oral route, direct inoculation of conjunctiva bitonometers or fingers, or tick or mosquito bite. Rubella virus is a member of the family of A. Adenovirus. B. Herpes virus. C. Picornavirus. D. Neisseria. E. Toga virus. The answer is E. Toga virus. Rubella virus is a member of the Toga virus family and not the herpes virus, Neisseria, family of bacteria, adenovirus, and picornavirus. Which of the following clinical conditions is associated with the Coxsackie virus type B? A. Gingivostomatitis. B. Herpangina. C. Bornholm disease. D. Hepatocellular carcinoma. The answer is C. Bornholm disease. Coxsackie virus type B is associated with Bornholm disease seen mainly in older children and young adults. Bornholm disease or epidemic pleurodenia or epidemic myalgia is a disease caused by the Coxsackie B virus. It is characterized by myositis causing paroxysms of stabbing pain in the chest muscles and abdomen muscles. Coxsackie virus type A and Coxsackie virus type B are members of the Picornaviridae family. Picornaviruses are naked viruses with an icosahedral nucleocapsid. The genome consists of single molecule of single-stranded RNA. Coxsackie virus type A is associated with herpangina, which is commonly seen in children. Herpangina is a severe febrile pharyngitis characterized by vesicles or nodules primarily on the soft palate. Subacute sclerosing painencephalitis is a late neurological sequelae of infection from what virus? A. Parvovirus B19. B. Arthreovirus. C. Papillomavirus. D. Measles virus. E. Hepatitis B virus. The answer is D. Measles virus. Subacute sclerosing painencephalitis, SSPE, is a serious, late, and rare neurological complication occurring 10 years after recovery from measles. This fatal disease is characterized by a very slow replication and spread of measles virus in the brain. Patients with SSPE do not show a high number of measles viruses in the brain, but they demonstrate unusually high levels of measles antibody in the blood and cerebrospinal fluid. Many years after recovering from measles, patients develop changes in personality, behavior, and memory. Those symptoms are followed by myoclonic jerks, blindness, and spasticity. Infectious mononucleosis can be caused by what? A. Cytomegalovirus. B. Adenovirus. C. Rickettsia. D. Epstein-Barr virus. E. Herpes virus. The Epstein-Barr virus causes infectious mononucleosis associated with the Burkitt's lymphoma in East African children. The virus is found in human oropharynx and B lymphocytes. It is transmitted primarily by saliva. The infection begins in the pharyngeal epithelium, spreads to the cervical lymph nodes, then travels through the blood to the liver and spleen. Epstein-Barr virus belongs to the family Herpesviridae and is the causative agent of infectious mononucleosis, Burkitt's lymphoma, and undifferentiated nasopharyngeal carcinoma. Infectious mononucleosis characteristically produces a marked lymphocytosis involving almost all of the lymphoarticular tissues. This leads to hepatomegaly, splenomegaly, lymphadenopathy, and lymphoid hyperplasia of the oronasopharynx. The peripheral blood smear contains atypical lymphocytes of the Downey 2 type. It is generally a self-limiting disease, however, it can cause a severe protracted illness that can at times prove to be fatal. Patients with an unusual immunodefect known as the X-linked lymphoproliferative syndrome frequently have overwhelming EBV primary infections, which can be fatal in the majority of the cases. Which of the following viruses consists of circular DNA that is partially double-stranded and partially single-stranded? A. Respiratory syncytial virus. B. Epstein-Barr virus. C. Hepatitis B virus. D. Varicella zoster virus. E. Lassa fever virus. The answer is C. Hepatitis B virus. Hepatitis B virus is the DNA virus that is part of the Hepatnoviridae family. The characteristic feature of the virus from this family is that the genome consists of a circular DNA that is part double-stranded and part single-stranded. The virions are spherical particles with an envelope. Hepatitis B virus consists of icosahedral core within a closely adherent capsid that contains cellular lipid, glycoproteins, and a virus-specific surface antigen called hepatitis B surface antigen, HBsAg. Respiratory syncytial virus is RNA virus that has linear single-stranded non-segmented RNA. Lassa fever virus has a circular single-stranded RNA in 2 segments. Varicella-Zoster virus and Epstein-Barr virus consist of a linear double-stranded DNA. Which one of the following is an example of a chronic carrier infection? A. Toga virus. B. Hepatitis B. C. Neonatal rubella virus. D. Retrovirus. E. Cytomegalovirus. The answer is B. Hepatitis B. Hepatitis B is an example of a chronic carrier infection where a carrier state can follow an asymptomatic infection, as well as actual disease. Neonatal rubella virus, cytomegalovirus, retrovirus, and Toga virus do not cause chronic carrier infection. HBsAg may remain detectable for life in many patients. Individuals who have positive findings for HBsAg are termed carriers of HBV. They may be inactive carriers or they may have chronic hepatitis. Anti-HBC is present in all patients with chronic HBV infections. The AG and HBV DNA may or may not be present. They reflect a state of active viral replication. HBV DNA levels are typically low or absent in inactive carriers. HBV DNA levels are higher in patients with chronic hepatitis B. High HBV DNA levels are associated with increased infectivity. Which of the following is a major cause of serious diarrhea in young children? A. Arenavirus. B. Parainfluenza. C. Human rotavirus. D. Herpes simplex virus. E. Coxsackie virus A. The answer is C. Human rotavirus. Rotaviruses can survive the acidic environment in stomach. The virus infects the small intestine and damages the epithelial cell lining the villi. The virus causes permeability changes and cell lysis, leading to malabsorption with water and electrolyte imbalance. Rotaviruses are a major cause of diarrhea in young children and are associated with outbreaks in preschool and daycare centers. Rotaviruses cause extensive tissue damage, leading to serious fluid and electrolyte loss. A 20-year-old pregnant woman presents at 21 weeks gestation with symptoms and signs of preeclampsia. Her symptoms have been present for the past 2 days. Prior to that, she had flu-like symptoms and a lace-like rash on her trunk and extremities and a flushed face. Intrauterine fetal demise was detected by ultrasonogram. Labor was induced, and a stillborn male fetus was delivered. Serum was collected for viral titers of the suspected agent that had caused the patient's flu-like symptoms and fetal demise. The viral IgM titers were positive, as suspected. What is the most likely offending agent? A. Parvovirus B19. B. Herpes simplex type 2. C. Herpes simplex type 1. D. Cytomegalovirus. E. Epstein-Barr virus. The answer is A. Parvovirus B19. Parvovirus B19 is a member of the family Parvoviridae and is the causative agent of erythema infectiosum, fifth disease. The hallmark symptom of erythema infectiosum is a mild rubella-like erythematous rash that produces arthropathy, especially in women. The disease has two separate components. The first component is the lytic phase, where the lytic action of the virus replication in erythroid precursors gives rise to a transient arrest of erythrocytic production. This can result in a slight drop in hemoglobin. Hemoglobin levels will substantially drop in those patients with chronic hemolytic anemia. This is the viremic stage, and mild flu-like symptoms with pyrexia and chills are not uncommon. These flu-like symptoms can last for 1 to 3 days. 1 week after the viremia peak, the second phase occurs, where the virus is rarely detectable. The second phase is where the erythematous maculopapular rash and arthropathy occur. The characteristic rash produces a lace-like appearance on the trunk and extremities and a slap cheek appearance on the face. Erythema infectiosum infections in pregnant women can induce fetal loss, 5 to 20%, especially if the infection occurs at less than 20 weeks. Which of the following best describes human papillomaviruses? A. Human papillomaviruses are small DNA viruses. B. Human papillomaviruses are large DNA viruses. C. Human papillomaviruses are large RNA viruses. D. Human papillomaviruses are small RNA viruses. The answer is A. Human papillomaviruses are small DNA viruses. These viruses replicate in the nuclei of differentiated keratinocytes and are the cause of tumors of the skin and mucosa. The genome of human papillomaviruses is circular and contains approximately 8,000 base pairs. For which of the following viruses is assay by viral enzymes particularly useful? A. Retroviridae. B. Hepatitis B virus. C. Mumps virus. D. Parainfluenza. E. Influenza. The answer is B. Hepatitis B virus. No suitable cell culture system is currently available for the hepatitis B virus. Fortunately, the hepatitis B virus produces a DNA-dependent polymerase that is virus-specific. Influenza A, Influenza B, mumps virus, and parainfluenza virus may be cultured in primary monkey kidney cells. Influenza A, B, and C all may be cultured in eggs. Influenza A and B may be detected by hemadsorption, cytopathic effect, and hemagglutination. Influenza C may be detected by hemagglutination. Retroviridae may be cultured in T lymphocytes with methods of detection of transformation, reverse transcriptase, cytopathic effect, or immunofluorescence. Which statement is true concerning these three sexually transmitted viruses: human papillomavirus, herpes simplex virus, and hepatitis B virus? A. Of these viruses, only human papillomavirus has a genome containing RNA. B. These viruses all have a genome containing RNA. C. Of these viruses, only hepatitis B virus has a genome containing RNA. D. These viruses all have a genome containing double-stranded DNA. E. Of these viruses, Only herpes simplex virus has a genome containing RNA. The answer is D. These viruses all have a genome containing double-stranded DNA. Human papillomavirus, herpes simplex virus, and hepatitis B virus are sexually transmitted viruses with double-stranded DNA genomes. While herpes simplex virus has a relatively large genome, the genome of both human papillomavirus and hepatitis B virus are both quite small. Herpes virus can be detected by the Tsank smear of the skin lesion. This test stains for the presence of which one of the following? A. Dead cells. B. Inclusion bodies. C. Multinucleated giant cells. D. Herpes DNA. E. Herpes cell envelope. The answer is C. Multinucleated giant cells. The Tsank smear stains for the presence of multinucleated giant cells that are formed as a result of fusion of cell membranes due to insertion of viral proteins into the membrane. Tsank smear does not detect the presence of inclusion bodies, dead cells, herpes DNA, or cell envelope. Which of the following is an etiological agent of infectious hepatitis and a member of the Picornaviridae family? A. Hepatitis C virus. B. Hepatitis B virus. C. Hepatitis D virus. D. Hepatitis A virus. E. Hepatitis C virus. The answer is D. Hepatitis A virus. Hepatitis C is an enveloped icosahedral RNA virus with gene order characteristic of the family Flaviviridae. The genome of hepatitis C is infectious and consists of a linear single-stranded 9.5 kilobits molecule of RNA. The virus replicates in the cytoplasm. Hepatitis C is transmitted by parenteral and sexual routes. It is the most common cause of post-transfusion hepatitis. Hepatitis C is associated with acute infection, chronic liver disease, and cirrhosis. Hepatitis C viral infection may serve as a predisposing factor in primary hepatocellular carcinoma. Hepatitis A virus and hepatitis C virus are not associated with parenteral transmission. Chronic carrier state. Chronic hepatitis. Cirrhosis. Hepatocellular carcinoma, hepatitis B virus, hepatitis C virus, and hepatitis D virus are associated with parenteral transmission. Chronic carrier state. Chronic hepatitis. Cirrhosis. Hepatocellular carcinoma. A group of teens go on an exploration trip. Against the advice of her friends, a 15-year-old girl goes off by herself and enters a cave. She sees a bat that is unable to fly and, in an attempt to see if it is hurt, approaches it. Unfortunately, she gets bitten by the bat. Because she had been forewarned about entering the cave, she is too embarrassed to tell anybody about the bite. Besides which, the bite marks are small, so she is not concerned. A few weeks after the trip, she becomes very ill. She develops fever, headache, and fatigue. This is followed by hallucinations, seizures, and episodes of agitation. In addition, when she swallows, she has dramatic muscle spasms. She progresses to a coma and then dies. What would be found on autopsy in her brain? A. Howell-Jolly bodies. B. Russell bodies. C. Negri bodies. D. Dull bodies. E. Foam cells. The answer is C. Negri bodies. The girl contracted rabies from the bat bite. Since she did not tell anybody about the incident, appropriate prophylactic measures were not taken. The neurologic symptoms she had are all consistent with rabies infections. Rabies is also referred to as hydrophobia because of the muscle spasms that occur when swallowing. The virus which causes rabies is a member of the family of Rhabdiviridae, rhabdovirus. The virus contains a single strand of RNA. Negri bodies are cytoplasmic inclusions seen with rabies. Dull bodies are seen in white blood cells with burns, infections, trauma, and some other conditions. Russell bodies are intracellular accumulations of protein. Foam cells are lipid-laden macrophages. Howell-Jolly bodies are nuclear remnants seen in red blood cells, particularly after splenectomy. It is 9 a.m. on a Monday morning. The nurse tells you that a 20-year-old white male has been worked into the schedule. He has told the nurse that he has had the flu over the weekend. He thought that he would get better. But now his roommate tells him that he looks yellow. In taking the history he complains of malaise, lassitude, anorexia, headache, and low-grade fever for the past week. The only good thing he reports is he doesn't want to smoke. What is your working diagnosis? A. Hepatitis A or B? B. Hepatitis non-A or non-B? C. Hepatitis B. D. Hepatitis A. E. Hepatitis A or B or C? The answer is E. Hepatitis A or B or C. The morphologic changes in the liver are often similar for the various categories of viral agents. The liver can appear normal in size and color but is sometimes slightly edematous, enlarged, and bile-stained. On the cellular level, liver cell injury and necrosis and periportal inflammation can be seen. HAV is primarily transmitted through oral ingestion of fecal contaminated material. Transmission by blood transfusion is possible, but is uncommon. HAV is commonly spread among children, or food or water contaminated by fecal matter. Undercooked shellfish may also harbor the virus. HBV is primarily transmitted parenteral and across mucous membranes, especially by sexual intercourse. The average length of the incubation period is 120 days. HBsAg has been found in almost every body fluid from infected persons: blood, semen, saliva, tears, ascites, breast milk, urine, and even in feces. Treatment including bed rest during the acute phase and a diet that is both acceptable and nutritious are the usual general measures. Prevention requires immunization for HAV as well as passive and active immunization for HBV. Although the usual way in which a particle enters a cell is by phagocytosis so that the particle is enclosed in a phagocytic vacuole, there are other methods of entry. If viruses enter cells by phagocytosis, they are destroyed by hydrolytic enzymes. How do most non-enveloped and enveloped viruses enter cells? A. Phagocytosis. B. Neutralization. C. Endocytosis. D. Pinocytosis. E. Opsonization. The answer is C. Endocytosis. Most viruses enter the cell using endocytosis, the invagination of the plasma membrane into smaller virus-sized depressions coated on the cytoplasmic side with a cellular protein known as clathrin. These detach from the plasma membrane and become vesicles free in the cell's cytoplasm. These vesicles fuse with acidic compartments called endosomes. Endosomes then fuse with lysosomes containing degradative enzymes to reduce the ingested molecules to small breakdown products. Macrophages and other phagocytic cells have receptors for the Fc portion of the antibody molecule. These receptors provide a handle for phagocytes to bind coated particles. The coating of pathogens and foreign particles by antibodies is known as opsonization. The simplest and most direct way in which antibodies can protect from pathogens or their toxic products is by binding to them, thereby blocking their access to cells that they may infect or destroy. This is known as neutralization and is important for protection against bacterial toxins and against pathogens such as viruses, which can thus be prevented from entering cells and replicating. Phagocytosis is the ingestion of these coated pathogens or particles by macrophages or other phagocytes, followed by internalization and destruction by intracellular digestion. Pinocytosis is the simple cellular uptake of fluid and solutes. It is a much simpler process than phagocytosis. A virologist specializing in systematics, the study of relatedness of organisms, analyzed data from several studies. Which of the following pairs of viruses are most closely related? A. Enteroviruses and rhinoviruses. B. Rotavirus and echoviruses. C. Enteroviruses and rotavirus. D. Rhinoviruses and orbivirus. E. Poliovirus and orbivirus. The answer is A. Enteroviruses and rhinoviruses. Both the enterovirus group, which includes the poliovirus, Coxsackie viruses, and echoviruses, and the Reoviridae, which includes the reovirus, orbivirus, and rotavirus, have an RNA genome. The genomes of the enterovirus group are linear and single-stranded, whereas those of the Reoviridae are double-stranded and may be either linear or segmented. The Picornaviridae family of viruses contains the enterovirus and the rhinoviruses, which have numerous properties in common with each other. Viruses of this family lack an envelope, and are icosahedral, with a diameter of 20 nanometers. The genome is a single-strand RNA. The enteroviruses are stable to acid, while the rhinoviruses are acid-sensitive. The only double-stranded RNA viruses belongs to the family A. Arenoviridae. B. Picornaviridae. C. Retroviridae. D. Reoviridae. E. Togaviridae. The answer is D. Reoviridae. Most of the families of RNA viruses infecting human consists of single strand of RNA, except the family Reoviridae. The virions in Reoviridae family consists of double-stranded RNA, made up of 10-12 segments that separates them from other RNA viruses. Reoviruses are naked with icosahedral symmetry. Reoviruses replicate in the cytoplasm and are released by cell lysis. Which of the following is a non-enveloped RNA virus from the family Calciviridae that is associated with cholestasis? A. Hepatitis B virus. B. Hepatitis A virus. C. Hepatitis C virus. D. Hepatitis D virus. E. Hepatitis C virus. The answer is C. Hepatitis C virus. Hepatitis C is an enveloped icosahedral RNA virus with gene order characteristic of the family Flaviviridae. The genome of hepatitis C is infectious and consists of a linear single-stranded 9.5 kilobits molecule of RNA. The virus replicates in the cytoplasm. Hepatitis C is transmitted by parenteral and sexual routes. It is the most common cause of post-transfusion hepatitis. Hepatitis C is associated with acute infection, chronic liver disease, and cirrhosis. Hepatitis C viral infection may serve as a predisposing factor in primary hepatocellular carcinoma. A 27-year-old woman presents to her primary care provider with upper respiratory symptoms. An examination of throat swabs and stool specimens indicates the presence of virus particles. Examination of throat swabs and stool specimens is appropriate when, which of the following viruses is suspected? Examination of throat swabs and stool specimens is appropriate when, which of the following viruses is suspected? A. Cytomegalovirus. B. Papillavirus. C. Enterovirus. D. Influenza. E. Parainfluenza. The answer is C. Enterovirus. Among the respiratory viruses that can be isolated from throat secretions are influenza, parainfluenza, respiratory syncytial virus, and rhinovirus. These may also be present in nasal washes, nasopharyngeal swabs, lung biopsy, and aspirates of the lower respiratory tract. Additional respiratory viruses, which may be isolated from the stool in addition to the aforementioned locations, are the enterovirus and adenovirus. Certain viruses, which affect the central nervous system, may be isolated from throat swabs, including enterovirus. Cytomegalovirus and herpes simplex viruses are among the viruses, which also can cause CNS illness. These two also cause congenital or perinatal exanthem, in which case isolation may be made from throat swabs. Which one of the following statements best describes prions? A. They are infectious particles composed solely of proteins. B. They are composed of viral nucleic acids but cannot replicate without a helper virus. C. They contain host cell DNA instead of viral DNA within the capsid. D. They consist solely of a single molecule of circular RNA without a protein coat or envelope. E. They are protein particles that generate a strong immune response. The answer is A. They are infectious particles composed solely of proteins. Prions are infectious particles composed solely of proteins. They are not composed of viral nucleic acids and do not need a helper virus to replicate. They do not contain host cell DNA instead of viral DNA within the capsid. They do not consist solely of a single molecule of circular RNA without a protein coat or envelope, and they are not protein particles that generate a strong immune response. A 32-year-old new patient presents for a routine physical exam. The patient confides that he is HIV positive. He has not sought any medical help. During examination of his oral cavity, raised areas that are whitish tan in color with feathery appearance on his tongue are noted. Attempts to scrape the area off for sampling are unsuccessful. What is the most likely diagnosis? A. Hairy leukoplakia. B. Hairy tongue. C. Geographic tongue. D. Candidiasis. E. Atrophic glossitis. The answer is A. Hairy leukoplakia. Hairy leukoplakia may be seen in people infected with HIV and AIDS. It is characterized by raised areas that are whitish tan in color that have a feathery appearance. It is different from candidiasis of the tongue in that hairy leukoplakia cannot be scraped off. A hairy tongue is not actually due to hair growth on the tongue, it consists of elongated papillae that have the appearance of grayish-black hair to the naked eye. This condition may be caused by antibiotic use, or there may not be any reason. Atrophic glossitis, or smooth tongue, presents as having a smooth surface due to papillae loss. The loss may indicate deficiency in riboflavin, niacin, folic acid, vitamin B12, pyridoxine, or iron. A geographic tongue is a benign condition with an unknown cause. It is characterized by a map-like pattern of smooth, red areas that do not have papillae as well as rough areas that still have papillae. Although candidiasis is also common with people with AIDS and the infection also causes the tongue to have a white coating, The coat can be scraped, and a sample can be analyzed for the presence of Candida. Fissured tongue is a benign condition characterized by deep grooves, fissures, in the dorsum of the tongue. Although these grooves may look unsettling, the condition is usually painless. Some individuals may complain of an associated burning sensation. The cause is unknown, but it may be partly a genetic trait. Aging and environmental factors may also contribute to the appearance. An unknown virus has been isolated in the laboratory from mouse epithelial cells, which contain reverse transcriptase. The genetic material from this virus is examined and found to contain adenine, guanine, cytosine, and uracil, but no thymine. What can be concluded about it? A. It can only infect bacteria. B. It cannot undergo integration. C. It is a retrovirus. D. It is a prion particle. E. It is a DNA virus. The answer is C. It is a retrovirus. A retrovirus contains RNA as its genetic material, and uses the enzyme reverse transcriptase to convert its single-stranded RNA genome into a DNA/RNA helix, which is then converted to a DNA duplex. This then inserts into the host chromosome, is replicated, and eventually gives rise to single-stranded RNA to be incorporated into the new viral particle. RNA and DNA have three bases in common: adenine, guanine, and cytosine, but RNA contains uracil and DNA contains thymine as the fourth base. Therefore, finding uracil in the viral genome indicates that it is an RNA-containing virus. Since it contains reverse transcriptase, we can deduce that it is retrovirus. Which of the following methods is the most precise, universally useful technique for enumerating infective virus particles? A. Electron microscopy hemagglutination. B. Pock assay. C. Plaque or focal assay. D. Quantal assay. E. None of these. The answer is C. Plaque or focal assay. The keys to this question are the terms universally useful and infective. Some of the described methods lead to the counting of both viable and non-viable particles, as described below. The plaque assay is the most precise measure of infectivity. The basis of this technique is the formation of clear zones, plaques or foci, in a monolayer of host cells. Serial dilutions of the virus are added to a monolayer of cells known to be infected by the cells. For example, MDCK cells are used for influenza. Most commonly after the virus has been allowed to adsorb bone to the cells, an agar overlay is added to prevent dispersion of the virus. This ensures that each plaque represents only a single initial virus particle. For viruses which only infect contiguous cells without releasing virions into the surrounding medium, the agar may be replaced by a liquid. A 21-year-old woman developed low-grade fever, sore throat, malaise, and fatigue that lasted several days. Physical examination revealed swollen lymph nodes and discomfort in the left upper quadrant of the abdomen. Examination of peripheral blood smear revealed 50% of atypical lymphocytes of the total white cells. Result for heterophile antibody test was positive. What is the most probable cause of infection? A. Respiratory syncytial virus. B. Cytomegalovirus. C. Influenza virus. D. Epstein-Barr virus. E. Varicella-Zoster virus. The answer is D. Epstein-Barr virus. Epstein-Barr virus and cytomegalovirus elicit a large T-cell response, resulting in a mononucleosis-like syndrome. EBV infection is subclinical and milder in children than adolescents or adults. EBV initiates infection in the epithelial cells of the oropharynx and then spreads to the B lymphocytes in lymphatic tissue and blood. Classical lymphocytosis is associated with the activation and proliferation of suppressor T cells, and it leads to infectious mononucleosis. The atypical lymphocyte, also known as Downy cells, increases in peripheral blood during the second week of infection. Major T-cell response causes swollen lymph glands, spleen, and liver. Fever, malaise, fatigue, pharyngitis, lymphadenopathy, and hepatosplenomegaly are the classical symptoms associated with infectious mononucleosis. An epidemiologist studies virology data including the names of virus families and the nature of the genome. Which of the following families contain RNA viruses? A. Herpes viridae. B. Parvoviridae. C. Poxviridae. D. Reoviridae. E. Adenoviridae. The answer is D. Reoviridae. Except for the Reoviridae, which contains the orbiviruses, rotaviruses, and reoviruses, all of the families mentioned are DNA viruses. The Parvoviridae and Adenoviridae families contain the parvovirus and adenovirus, respectively. The viruses in both of these families have a naked virion, that is, without an envelope, but viruses in the former family have a complex nucleocapsid structure, while those in the latter family have an icosahedral nucleocapsid symmetry. The herpes simplex virus, cytomegalovirus, varicella zoster virus, and the Epstein-Barr virus all belong to the herpes viridae family. The family of poxviridae contains complex viruses with a naked virion, such as the vaccinia, smallpox, and variola viruses. An epidemiologist at a school of public health of a major medical school examined data from several studies performed by microbiologist. The data set included information about the nature of the etiological agent, virus, rickettsia, chlamydia, viroid, the nature of the genome, DNA or RNA, and whether the agent is obligate intracellular or parasitic. The epidemiologist wishes to determine which features pertain to each disease agent. Which of the following properties is unique to viruses alone? Which of the following properties is unique to viruses alone? A. Obligate intracellular. B. Extracellular. C. Presence of DNA genome. D. Parasitic. E. Presence of an RNA genome. The answer is E. Presence of an RNA genome. Rickettsia, chlamydia, prions, and viroids can be distinguished from viruses, but not by just one of the mentioned criteria. While all of these groups are obligate intracellular organisms, only the viruses are parasites with an absolute intracellular requirement, which also depend on the machinery of the host cell for replication. Prions are small infectious protein particles. Viroids are subviral infectious nucleic acids, which lack even the protein capsid found in viruses. Viruses may contain a genome of DNA or RNA, so the presence of an RNA genome is indicative of a virus, but the presence of a DNA genome is not. Which of the following is an enveloped RNA virus from the family Flaviviridae and is the major cause of post-transfusion hepatitis? A. Hepatitis B virus. B. Hepatitis D virus. C. Hepatitis C virus. D. Hepatitis C virus. E. Hepatitis A virus. The answer is C. Hepatitis C virus. Hepatitis C is an enveloped icosahedral RNA virus with gene order characteristic of the family Flaviviridae. The genome of hepatitis C is infectious and consists of a linear single-stranded 9.5 kilobits molecule of RNA. The virus replicates in the cytoplasm. Hepatitis C is transmitted by parenteral and sexual routes. It is the most common cause of post-transfusion hepatitis. Hepatitis C is associated with acute infection, chronic liver disease, and cirrhosis. Hepatitis C viral infection may serve as a predisposing factor in primary hepatocellular carcinoma. Which of the following clinical conditions is associated with Coxsackie virus type A? A. Herpangina. B. Hepatocellular carcinoma. C. Smallpox. D. Gingivostomatitis. E. Cervical cancer. The answer is A. Herpangina. Coxsackie virus type A and Coxsackie virus type B are members of the P. cornaviridae family. Coxsackie virus type A is associated with herpangina, which is commonly seen in children. Herpangina is a severe febrile pharyngitis characterized by vesicles or nodules primarily on the soft palate. The majority of cervical cancers, approximately 90%, contain human papillomavirus DNA, usually of type 16 or 18. A researcher specializing in systematics of viruses tabulates data from several epidemiological studies. The data she receives include the names of the individual viruses, the families to which they belong, the type of genome, presence of an envelope, the morphology of the virion, and which viruses are related to each other. Which of the following families contains the influenza virus? A. P. cornaviridae. B. Coronaviridae. C. Orthomyxoviridae. D. Rhabdoviridae. E. Parmyxoviridae. The answer is C. Orthomyxoviridae. All of the families mentioned are RNA viruses. The P. cornaviridae family contains viruses that lack an envelope and are icosahedral, rather than helical, in morphology. The P. cornaviridae family contains enterovirus, cardiovirus, and rhinovirus. The Orthomyxoviridae family contains the influenza virus, while the Paramyxoviridae family contains the parainfluenza virus. The Rhabdoviridae and Coronaviridae families contain the rabies virus and coronaviruses, respectively. A 1-year-old boy presents with barking cough and inspiratory stridor. What virus is the probable causative agent of the infant's illness? A. Parainfluenza virus. B. Influenza A. C. Rhinovirus. D. Respiratory syncytial virus, RSV. E. Adenovirus. The answer is A. Parainfluenza virus. The child has the characteristic symptoms of laryngotracheobronchitis, commonly known as croup. All of the listed viruses can cause respiratory tract infections in infants and young children, each producing different clinical manifestations. Parainfluenza virus is the most common agent of croup. Types 1 and 2 are particularly associated with this disease. Croup is characterized by respiratory obstruction due to swelling of the larynx and related structures. Infection may spread deeper to the lower trachea and bronchi, culminating in pneumonia and bronchitis. The infection is seen mostly in 6 to 18-month-old children. How is the recombination of RNA segments from two different influenza virus strains described? A. Peptidoglycan. B. Antigenic drift. C. Antigenic shift. D. Teichoic acids. E. Prions. The answer is C. Antigenic shift. Antigenic shift and antigenic drift can be found in the influenza virus. Antigenic shift is a process by which two or more different types of influenza A combine to form a virus radically different from the ancestor strains. Antigenic shift occurs in two ways. 1. Antigenic shift can occur through genetic recombination, or reassortment, when two or more different influenza A viruses infect the same host cell and combine their genetic material. 2. An influenza A virus can jump from one type of organism, usually a bird, to another type of organism, such as a human, without undergoing major genetic change. A point mutation that leads to an amino acid change and altered antigenic sites so that the virus is no longer recognized by the host immune system is called antigenic drift. Peptidoglycan and teichoic acids are components of the bacterial cell wall and prions are infectious protein particles. A patient has all the gastrointestinal symptoms of infection with hepatitis virus, HAV, yet all the tests for HAV-IgG and HAV-IgM are negative. Laboratory diagnosis reveals A. Positive, RNA virus. Which of the following is the most probable diagnosis? A. Rhinovirus. B. Hepatitis C. C. Hepatitis C. D. Yellow fever. E. Rotavirus. The answer is C. Hepatitis C. Hepatitis C virus is a naked, plus, strand, ssRNA virus. It has clinical and biochemical features that are very similar to hepatitis A, except that it seems to be more severe in pregnant women. Therefore, hepatitis C is the virus that is most likely the cause of disease in this case, if serology indicated the absence of hepatitis A. The other choices are incorrect. Hepatitis C is enveloped and does not cause gastrointestinal symptoms. Rhinovirus causes common cold. Rotavirus does not present with jaundice as do hepatitis-causing viruses. Last, yellow fever can be associated with hepatitis, but it is a lot more severe in presentation than hepatitis A and is transmitted by mosquitoes, not fecal-orally. This large enveloped dsDNA virus is associated with 70% of the initial genital infections by this virus group. Clinically, these infections present with small erythematous papules which progress to open ulcerations. Infections can become latent and recurrent. Which virus is this? A. HIV-2. B. HIV-1. C. HSV-2. D. HSV-1. The answer is C. HSV-2. Herpes simplex type 1 and 2, HSV-1, HSV-2, are both large enveloped DNA viruses which cause latent and recurrent infections. However, HSV-1 is primarily associated with infections of the pharynx, skin, and central nervous system. On the other hand, HSV-2 is primarily associated with genital infections, representing approximately 70% of all such initial infections. HSV-2 infections recur more often as well. Which of the following viral pathogens is associated with genital diseases? A. Respiratory syncytial virus, influenza virus, parainfluenza virus. B. Rotavirus and Norwalk virus. C. Dengue fever virus and Lassa fever virus. D. Coxsackie virus type B and echoviruses. E. Human papillomaviruses and herpes simplex virus type 2. The answer is E. Human papillomaviruses and herpes simplex virus type 2. Genital tract infections by human papillomaviruses is considered a sexually transmitted disease. HPV type 6 and 11 are mostly implicated in genital warts that are found on the squamous epithelium of external genitalia and perianal areas. Intraepithelial neoplasia and carcinoma often result from genital tract infections caused by HPV type 16 and 18. Herpes simplex virus type 2 is a major cause of genital herpes, which is another sexually transmitted disease. Primary infection is accompanied by inguinal adenosis, fever, malaise, myalgia, and lesions on genital areas. Which of the following viral inclusions correspond with the pox virus? A. Owl's eye intranuclear basophilic inclusion body in cells of tissues or urine sediment. B. Cowdrey type A intranuclear inclusion body in single cells or in large syncytia. C. Perinuclear acidophilic inclusion body in the cytoplasm. D. Garnieri bodies in the cytoplasm of infected cells. E. Negri bodies, intracytoplasmic, in brain tissue. The answer is D. Garnieri bodies in the cytoplasm of infected cells. The inclusion bodies are the stainable structures found within the nucleus or cytoplasm of the host cell. Inclusion bodies result from the histological changes caused by the presence of viral components or the changes in the cell structure mediated by the infecting virus. The detection of the inclusion bodies by microscopic examination can be used for laboratory diagnosis of the viral infection, as they are characteristic for particular viral infections. Garnieri bodies are inclusion bodies, associated with infection with the pox virus. The scraping of cells from the lesion is stained and examined microscopically. Garnieri bodies appear as acidophilic inclusions in the cytoplasm of infected cells. Which of the following viral inclusions correspond with the herpes simplex virus? A. Owl's eye intranuclear basophilic inclusion body in cells of tissues or urine sediment. B. Cowdrey type A intranuclear inclusion body in single cells or in large syncytia. C. Garnieri bodies in the cytoplasm of infected cells. D. Paranuclear acidophilic inclusion body in the cytoplasm. E. Negri bodies, intracytoplasmic, in brain tissue. The answer is B. Cowdrey type A intranuclear inclusion body in single cells or in large syncytia. The inclusion bodies are the stainable structures found within the nucleus or cytoplasm of the host cell. Inclusion bodies result from the histological changes caused by the presence of viral components or the changes in the cell structure mediated by the infecting virus. The detection of the inclusion bodies by microscopic examination can be used for laboratory diagnosis of the viral infection, as they are characteristic for particular viral infections. Cowdrey type A inclusions are intranuclear inclusion bodies characteristic of infection with varicella zoster virus, VZV, or herpes simplex virus, HSV. These inclusions can be found in single cells or in large syncytia. Examination of the HSV-infected cells in tissues or smear reveals giant cells with characteristic intranuclear inclusions that are acidophilic and are known as Cowdrey type A inclusions. Cowdrey type A inclusions are also seen in skin lesions, respiratory specimens, or organ biopsies in the cytological examination of cells infected with VZV. Which of the following is true of human adenoviruses? A. They are enveloped viruses with helical nucleocapsid. B. Genome consists of a circular single-stranded RNA. C. Replication occurs in the cytoplasm. D. Forms acidophilic intracytoplasmic inclusions. E. Encodes for its own DNA polymerase. The answer is E. Encodes for its own DNA polymerase. Adenoviruses are non-enveloped viruses with an icosahedral nucleocapsid. The capsid contains 12 pentons at each vertices with 12 fibers projecting from the vertices. The genome is a linear double-stranded DNA with terminal protein. Viral attachment proteins are present in the fibers projecting from the vertices of the virions. The additional characteristics of adenovirus include the following: the virions replicate in the nucleus, encode proteins to promote mRNA and DNA synthesis, including its own DNA polymerase, infects epithelial cells lining respiratory and enteric organs. Virus can become latent in lymphoid tissue and can be reactivated by immunosuppression or infection with other agents. Forms basophilic intranuclear inclusions within an infected epithelial cell. Last, they are commonly associated with respiratory diseases, adenoviral pneumonia, epidemic keratoconjunctivitis, and pharyngoconjunctival fever. What is the viral agent associated with progressive multifocal leukoencephalopathy in immunocompromised patients? A. Herpes simplex virus. B. Parainfluenza 1. C. Coxsackie virus A. D. JC virus. E. Lassa fever virus. The answer is D. JC virus. JC virus is a papavirus associated with progressive multifocal leukoencephalopathy, PML, in immunocompromised patients, including AIDS. PML is a subacute demyelinating disease of the central nervous system, which is primarily seen as a complication of advanced disseminated malignant conditions, such as Hodgkin's disease or chronic lymphocytic leukemia. The patient presents with multiple neurological symptoms. The symptoms are not attributable to a single anatomical lesion. Clinical manifestations include impairment of vision, speech, and coordination that can lead to paralysis and death. Human immunodeficiency virus, or HIV, is an enveloped human retrovirus of the lentivirus family. There is also a significant number of HIV-infected individuals who never become sick, never experience a decline in their CD4 counts, and never develop high plasma loads of viral RNA. The reasons that these individuals never become sick include host factors such as the presence of mutations that provide resistance to HIV, such as which of the following mutations? A. CCR5. B. CXCR4. C. IL-8. D. MAC1. E. SDF1. The answer is A. CCR5. CCR5 is necessary for HIV entry into the host cell. CCR5 is expressed by macrophages, dendritic cells, and CD4 T cells. It is thought to be the major co-receptor for establishing primary infection, since individuals who are homozygous for a mutation in CCR5 appear to be resistant to infection by HIV. For example, the CCR5 delta 32 deletion mutation seems to confer resistance against HIV-1 by blocking its attachment to CCR5 so that HIV cannot gain entry to the cell. Development of drugs directed at chemokine receptors is thus an active area of research. Which group should not receive the flu virus annually? A. Pregnant women. B. Healthy adults older than 18 years old. C. The elderly. D. None of these groups should receive the flu virus annually. E. All of these groups should receive the flu virus annually. The answer is E. All of these groups should receive the flu virus annually. The flu virus can be either live attenuated or inactivated. The Center for Disease Control and Prevention, CDC, recommends giving the flu virus annually to healthy adults, pregnant women, and children older than 6 months of age. The virus is different from year to year, and the vaccine each year represents the most common active forms of the virus. Vaccination is a type of primary prevention. Which of the following is the correct sequence of viral replication? A. Penetration, attachment, protein synthesis, uncoating, assembly, and release. B. Attachment, penetration, uncoating, protein synthesis, assembly, and release. C. Penetration, uncoating, attachment, protein synthesis, assembly, and release. D. Attachment, uncoating, penetration, protein synthesis, assembly, and release. E. Uncoating, attachment, penetration, protein synthesis, assembly, and release. The answer is B. Attachment, penetration, uncoating, protein synthesis, assembly, and release. Viral replication takes place in several stages. Once the virus recognizes the target cell, it binds to the cell. The viral attachment protein present on the surface of virion interacts with the cell receptor. Following attachment, the virus can penetrate the cell by process of endocytosis or fusion. In the step of uncoating the capsid, the envelope is removed and viral nucleic acid is released inside the host cell, so the viral genes become available for transcription. What mold produces aflatoxin, a common contaminant in peanuts, peanut butter, pistachios, Brazil nuts, and corn products? A. Cladosporium. B. Aspergillus. C. Penicillium. D. Mucor. The answer is B. Aspergillus. Aspergillus flavus is a mold species commonly found in peanut butter and many other foods. It produces aflatoxin, a toxin linked to increased risk of liver cell cancer. The other mold species listed are not considered to be related to liver cancer. Cladosporium species are rarely harmful to humans. Penicillium species produce antibiotics, which we commonly use to treat infections. Mucor species cannot grow in warm temperatures, and are unable to infect humans, with the exception of certain heat-tolerant strains, which may cause some zygomycosis. Which of the following is a fungus that may be responsible for certain cases of diaper rash? A. Sporothrux. B. Blastomyces dermatitis. C. Nemocystis girovicii. D. Candida albicans. E. Aspergillus fumigatus. The answer is D. Candida albicans. Candida albicans is a fungus present in the normal flora of humans. An overgrowth of this fungus may cause yeast infections of the skin, vagina, or mouth. After a child receives antibiotics, they may contract a mycotic diaper rash due to Candida albicans overgrowth since the normal bacterial flora have been eliminated by the antibiotics. Nemocystis girovicii may cause nemocystis pneumonia. Blastomyces dermatitis and Aspergillus fumigatus may cause lung infection if the spores are inhaled. Lastly, Sporothrix may cause a skin infection called sporotrichosis after it enters through a break in skin integrity. Which of the following human body systems are prions most likely to affect? A. The gastrointestinal system. B. The endocrine system. C. The reproductive system. D. The nervous system. E. The cardiovascular system. The answer is D. The nervous system. Prions are infectious protein particles that affect proteins, misfolding them and causing loss of function. They are most commonly found in the brain. Prion diseases are also called transmissible spongiform encephalopathies, TSEs, and include diseases such as mad cow disease and Creutzfeldt-Jakob disease. Which of the following regarding fungi is false? A. Thrush is an example of a fungal infection. B. Fungi are present as normal flora in the human body. C. Fungi are similar to plants in that they contain chlorophyll. D. Yeasts are considered fungi. E. A disease caused by a fungus may be termed a mycotic infection. The answer is C. Fungi are similar to plants in that they contain chlorophyll. Fungi are similar to plants in that they both have cell walls. Fungi have chitin cell walls and plants have cellulose cell walls, but they do not contain chlorophyll. Fungi such as Candida albicans are present in the normal flora of the human body. An overgrowth of fungi can cause mycotic infections such as a vaginal yeast infection, or orally as in thrush. The virus responsible for causing AIDS, HIV, is classified as a retrovirus. Many of the drugs used to treat HIV infection take advantage of a unique sequence of events involved in the replication of retroviruses. In order for HIV to replicate, which of the following steps must occur first? A. The host cell must synthesize reverse transcriptase. B. A DNA polymerase must be synthesized from the RNA template. C. The viral RNA must be degraded. D. New viral RNA molecules must be synthesized by the viral RNA polymerase. E. The viral RNA must be converted to DNA. The answer is E. The viral RNA must be converted to DNA. A retrovirus is an infectious particle consisting of an RNA genome packaged in a protein capsid, surrounded by a lipid envelope. This lipid envelope contains polypeptide chains, including receptor-binding proteins that link to the membrane receptors of the host cell, initiating the process of infection. In order to replicate, its genetic material, RNA, must first be converted to a DNA molecule by the enzyme reverse transcriptase. This enzyme, which is found in the virus particle, is a DNA polymerase that uses an RNA molecule as a template to synthesize DNA, resulting in an RNA/DNA double helix. The answer is E. Virus reservoirs in mononuclear phagocytes. Mononuclear phagocytes, MNPs, which consist of blood monocytes, tissue macrophages, and dendritic cells, are the main cellular elements responsible for elimination of viral pathogens. At the same time, MNPs are the targets and reservoirs for many viruses. Most noteworthy, the MNPs utilize phagocytosis as the first battle armament against the onslaught. This greatly diminishes the quantity of virus until other aspects of the immune system can be activated. An immunologist studying macrophages performs a series of experiments to study the pathophysiology and immunology of macrophages exposed to viral attack. Which of the following activities in macrophages is counterproductive for cellular defense against viral attack? A. Antigen presentation. B. Phagocytic activity. C. Reduction of viral infection, replication in other cells. D. Cytokine-initiated antiviral activity. E. Virus reservoirs in mononuclear phagocytes. What hormone stimulates a feeling of hunger? A. Gastrin. B. Cholecystokinin. C. Leptin. D. Ghrelin. The answer is D. Ghrelin. Ghrelin is a hormone produced primarily in the stomach and small intestine. It is secreted when the stomach is empty, triggering a feeling of hunger. When the stomach is stretched, secretion of ghrelin is inhibited. Leptin is a hormone secreted by adipose cells to signal satiety. Gastrin triggers the secretion of stomach acid during digestion, and cholecystokinin, CKK, is a hormone with various roles in the process of digestion, primarily acting as a hunger suppressant and a trigger for the release of digestive enzymes and bile. What is the name of the muscular ring that separates the small intestine from the large intestine? A. Ileocecal sphincter, valve. B. Cardiac sphincter. C. Pyloric sphincter. D. Lower esophageal sphincter. The answer is A. Ileocecal sphincter, valve. The ileocecal sphincter, valve separates the small intestine from the large intestine. The lower esophageal sphincter, also known as the cardiac sphincter, separates the esophagus from the stomach, while the pyloric sphincter separates the stomach from the small intestine. What is the name for the system of coordinated peristaltic waves that slowly sweeps food through the small intestine for digestion? A. Segmentation contractions. B. Mass movements. C. The migrating motor complex. D. None of these. The answer is C. The migrating motor complex. The system of coordinated peristaltic waves that slowly sweeps food through the small intestine for digestion is called the migrating motor complex. Disorderly motion of this complex can result in a wide variety of gastrointestinal complaints such as vomiting, dumping syndrome, bloating, or indigestion. Segmentation contractions mix the contents of the colon for more absorption, while mass movements serve to propel feces towards the rectum. All of the following are main functions of the large intestine except A. Store feces. B. Absorb electrolytes. C. Digest food. D. Absorb water. The answer is C. Digest food. By the time the contents of the digestive tract enter the colon, the majority of food digestion is complete. The colon then serves primarily to absorb water and electrolytes and to prepare feces for excretion. The duodenum wraps around what digestive organ? A. The pancreas. B. The liver. C. The stomach. D. The gallbladder. The answer is A. The pancreas. The duodenum wraps around the pancreas. The portions of the small intestine, in order from superior to inferior, are dash. A. Jejunum, cecum, duodenum. B. Duodenum, ileum, jejunum. C. Ileum, jejunum, cecum. D. Duodenum, jejunum, ileum. The answer is D. Duodenum, jejunum, ileum. The portions of the small intestine, in order from superior to inferior, are the duodenum, the jejunum, and the ileum. The cecum is not a part of the small intestine at all but rather the beginning of the large intestine. What nerve innervates the external anal sphincter? A. Perineal nerve. B. Cluneal nerve. C. Ilioinguinal nerve. D. The pudendal nerve. The answer is D. The pudendal nerve. The pudendal nerve innervates the external anal sphincter and is responsible for a person's ability to voluntarily control defecation. Dysfunction of the pudendal nerve has been associated with fecal incontinence or constipation. The other nerves listed are all part of the pelvic floor but do not directly innervate the anal sphincter. Absorption of nutrients in the small intestine occurs mainly in the underscore. A. Duodenum and ileum. B. Ileum and cecum. C. Duodenum and jejunum. D. Jejunum and ileum. The answer is C. Duodenum and jejunum. The majority of absorption of nutrients in the small intestine occurs mainly in duodenum and the jejunum. The ileum is still a site of some absorption, though it is far less than nutrient absorption in the superior parts of the small intestine. The cecum is part of the large intestine. What vein carries the nutrient-rich blood from the gastrointestinal system to the liver for processing? A. The hepatic portal vein. B. The splenic vein. C. The ileal vein. D. The left gastric vein. The answer is A. The hepatic portal vein. The hepatic portal vein is the main vein that carries nutrient-rich blood from the digestive tract to the liver for further processing. The other veins listed are all smaller veins that drain the stomach, small intestine, and spleen into the portal vein. What is the name of the muscular sphincter that keeps stomach contents from regurgitating into the esophagus? A. Ileocecal valve. B. Upper esophageal sphincter. C. Pyloric sphincter. D. Lower esophageal sphincter. The answer is D. Lower esophageal sphincter. The muscular sphincter that keeps stomach contents from regurgitating into the esophagus is the lower esophageal sphincter. The upper esophageal sphincter separates the esophagus from the pharynx, the pyloric sphincter separates the stomach from the small intestine, and the ileocecal valve separates the small intestine from the large intestine. The most superior part of the stomach is the dash. A. Fundus. B. Rugae. C. Body. D. Pyloric antrum. The answer is A. Fundus. The areas of the stomach, from superior to inferior, are the fundus, the body, and the pyloric antrum. The rugae are folds in the stomach that increase its surface area and expandability. What ligament attaches the liver to the abdominal wall? A. The falciform ligament. B. Ligamentum flava. C. The ligament of Treitz. D. The splenorenal ligament. The answer is A. The falciform ligament. The ligament of Treitz suspends the duodenum, while the splenorenal ligament goes between the left kidney and the spleen. Ligamentum flava are ligaments present in the spinal cord. Which of the following digestive enzymes breaks down starches? A. Lipase. B. Amylase. C. Protease. D. Peptidase. The answer is B. Amylase. Amylase enzymes, produced by the salivary gland and the pancreas, break starch down into simple sugars. Peptidase and protease enzymes break down proteins, while lipase enzymes break down lipids. Which of the following substances helps emulsify fats during digestion? A. Hydrochloric acid. B. Cholecystokinin. C. Bile acids. D. Pancreatic lipase. The answer is C. Bile acids. Bile acids, produced in the liver and stored in the gallbladder, help emulsify fats during digestion. The process of emulsification makes fats collect into small droplets, increasing the surface area of ingested lipids and increasing the ability of pancreatic lipase to break fats down into fatty acids and glycerol. Hydrochloric acid aids in the breakdown of proteins in the stomach, and cholecystokinin is a hormone with a wide variety of functions in the digestive process, including the stimulation of the release of bile, though it does itself not play a role in emulsification of fats. Which of the following would be a normal gastric pH? A. 4.0. B. 1.2. C. 4.8. D. 2.0. The answer is D. 2.0. Normal gastric pH ranges from 1.5 to 3.5. This highly acidic environment aids the stomach in denaturing proteins, a fundamental part of digestion. Where does lipid digestion begin? A. The jejunum. B. The duodenum. C. The ileum. D. The stomach. The answer is B. The duodenum. While a small amount of fat digestion may occur in the mouth via the action of lingual lipase, the majority of lipid digestions begins in the duodenum. The presence of fat in the small intestine triggers release of pancreatic lipase, which enters the duodenum via the pancreatic duct. Fat digestion does not occur in the stomach. Which of the following structures controls the release of pancreatic enzymes and bile into the duodenum? A. The ileocecal valve. B. The sphincter of Oddi. C. The pyloric sphincter. D. The ampulla of Vater. The answer is B. The sphincter of Oddi. The pancreatic duct and common bile duct come together at the ampulla of Vater, allowing for the combination of pancreatic enzymes and bile. This combination is released into the duodenum via the relaxation of the sphincter of Oddi, a muscular ring at the end of the ampulla. The sphincter of Oddi also prevents any backflow of duodenal contents into the ampulla. The pyloric sphincter controls flow of chyme between the stomach and the duodenum, while the ileocecal valve separates the small and large intestine. Lipids are transported out of the digestive tract via what system? A. The circulatory system. B. The lymphatic system. C. The hepatic system. D. The excretory system. The answer is B. The lymphatic system. Lipids are transported out of the digestive system via lacteals, lymphatic capillaries within the villi of the small intestine that absorb fatty acids in the form of chylomicrons. They are then transported through the lymphatic system and re-enter the bloodstream via the thoracic duct. The hepatic system produces bile, a vital part of lipid digestion, but it does not absorb lipids. Nor does the excretory system, which is not really a single system but rather a collection of organ systems including the kidney, skin, liver, and colon. Where is gastrin produced? A. Beta islet cells of the pancreas. B. Parietal cells of the stomach. C. Chief cells of the stomach. D. G cells of the stomach. The answer is D. G cells of the stomach. Gastrin is produced by the G cells of the stomach. Parietal cells of the stomach secrete hydrochloric acid, while chief cells secrete pepsinogen and chymosin. Beta islet cells of the pancreas produce glucagon. The hydrolysis of oligosaccharides into disaccharides occurs in what part of the digestive tract? A. The duodenum. B. The stomach. C. The ileum. D. The jejunum. The answer is A. The duodenum. The hydrolysis of oligosaccharides into disaccharides occurs in the duodenum, after the addition of pancreatic amylase from the pancreatic duct. What is the function of gastrin in the digestive tract? A. Increases gallbladder emptying. B. Triggers chief cells to secrete pepsinogen. C. Triggers parietal cells to release HCl. D. All of these are true. The answer is D. All of these are true. Gastrin, a peptide hormone released by G cells of the stomach, has many functions in digestion. It triggers parietal cells to release HCl, it increases gastric motility, it triggers chief cells to secrete pepsinogen, and it stimulates the gallbladder to release bile. Which of the following is not a brush border enzyme? A. Sucrase. B. Lactase. C. Carboxypeptidase. D. All of these are brush border enzymes. The answer is D. All of these are brush border enzymes. The intestinal brush border is the microvilli covered surface of the small intestine. It is where a large part of the digestive process occurs. aided by brush border enzymes such as sucrase, maltase, lactase, and carboxypeptidase. Which of the following is not an enzyme secreted by the pancreas? A. Amylase. B. Insulin. C. Lipase. D. Carboxypeptidase. The answer is B. Insulin. Insulin, while secreted by the pancreas, is not an enzyme. Rather, it is a peptide hormone that plays a role in lipid and blood sugar metabolism. The other enzymes listed are all pancreatic enzymes that play a role in digestion. Amylase breaks down carbohydrates, while lipase and sterolesterase break down fats. Carboxypeptidase is an enzyme that removes the final amino acid group from a protein. What cells of the stomach secrete hydrochloric acid, HCl? A. Chief cells. B. Parietal cells. C. M cells. D. Foveolar cells. The answer is B. Parietal cells. HCl is secreted by parietal cells of the stomach. Chief and foveolar cells of the stomach secrete pepsinogen and mucus respectively, and M cells are not stomach cells, but rather intestinal cells involved in mucosa-associated lymphoid tissues, or MALT. Mastication and peristalsis are examples of what type of digestion? A. Physical. B. Chemical. C. Mechanical. D. Oral. The answer is C. Mechanical. The two main forms of digestion and chemical and mechanical. Mechanical digestion involves the physical crushing, mixing, and breaking down of food particles into small pieces or slurries. Mechanical digestion primarily occurs with mastication and is carried out to some degree by peristaltic contractions of the stomach and intestine. Chemical digestion is the further breakdown of food particles into their molecular parts. This is carried out primarily via enzymes, HCl, and bile. What is a normal transit time for the stomach? A. 10 to 12 hours. B. 10 minutes to 4 hours. C. 5 to 10 minutes. D. 2 to 6 hours. The answer is B. 10 minutes to 4 hours. Stomach transit time varies widely. It can take anywhere from 10 minutes to 4 hours for food to pass through the pyle or sphincter into the duodenum. Transit time in the stomach is affected by the composition of the meal, and by the individual's rate of gastric emptying. Transit time may be shortened due to consumption of liquid or simple carbohydrate foods, or lengthened in the case of consumption of solid food that has a high protein or fiber content. What is the normal transit time of food through the small intestine? A. 3 to 8 hours. B. 8 to 12 hours. C. 12 to 18 hours. D. 1 to 2 hours. The answer is A. 3–8 hours. Normal transit time of food through the small intestine is 3 to 8 hours. This is significantly longer than transit time through the stomach due to the wider variety of digestive processes that occur in the small intestine, including the catabolism of proteins, lipids, nucleic acids, and simple and complex carbohydrates. What is the average transit time of the colon? A. 16 to 24 hours. B. 8 to 16 hours. C. 24 to 32 hours. D. 2 to 4 hours. E. 32 to 48 hours. The answer is E. 32 to 48 hours. The average colon transit time for both adults and children is between 32 and 48 hours. This is significantly longer than the transit times of food through the stomach and small intestine, which averages 4 to 12 hours total. A slow transit time through the colon can be increased by various lifestyle factors such as exercise and hydration, and dietary changes such as an increase in fiber-rich foods and avoidance of food allergies or other constipation triggers. Which of the following structures is the main blood supply to the small intestine? A. Inferior mesenteric. B. Superior mesenteric. C. Right hepatic. D. Left gastric. The answer is B. Superior mesenteric. The main artery supplying blood to the small intestine is the superior mesenteric artery. This vessel branches off the abdominal aorta and supplies the lower part of the duodenum, the ileum, the jejunum, and 2/3 of the transverse colon. The rest of the colon and the rectum are supplied by the inferior mesenteric artery, while the right hepatic and left gastric supply the liver and stomach, respectively. All of the following are salivary glands except A. Submandibular gland. B. Parotid gland. C. Sublingual gland. D. Thymus gland. The answer is B. Thymus gland. We have three main types of salivary glands: the parotid glands, the submandibular glands, and the sublingual glands. The thymus gland is not a salivary gland, and is located in the chest just superior to the heart. Which of the following is the main signaling molecule that acts on salivary acini or cells to increase production of saliva? A. Acetylcholine. B. Epinephrine. C. Dopamine. D. Serotonin. The answer is A. Acetylcholine. The primary signaling molecule that acts to increase saliva production by acini or cells in salivary glands is acetylcholine. Acetylcholine is released by parasympathetic innervation and triggers muscarinic receptors in salivary cells, leading to increased saliva secretion. While serotonin, epinephrine, and dopamine may have some effect on salivation, they are not the primary molecules through which the process is controlled. In what part of the brain is the swallowing center located? A. The medulla. B. The cerebellum. C. The thalamus. D. The cingulate gyrus. The answer is A. The medulla. The swallowing center is not a specific anatomical structure, rather an area of physiological control. The swallowing reflex is primarily controlled by the medulla, and to a lesser degree by the pons. None of the other structures listed play a significant role in deglutition. Which of the following molecules is necessary for absorption of vitamin B12? A. Intrinsic factor. B. Norepinephrine. C. Serotonin. D. Sodium. The answer is A. Intrinsic factor. Dietary vitamin B12 must first form a complex with intrinsic factor, a gastric glycoprotein, before it can be absorbed into the hepatic portal system. Individuals who are unable to produce intrinsic factor are at risk for developing B12-related macrocytic anemia. While the other molecules listed are necessary for a wide variety of digestive and nervous system function, they do not directly control vitamin B12 absorption. Which of the following enzymes breaks down triglycerides in chylomicrons and very low-density lipoproteins, VLDL? A. Hepatic lipase. B. Lipoprotein lipase. C. Colipase. D. Lingual lipase. The answer is B. Lipoprotein lipase. Lipoprotein lipase hydrolyzes triglycerides into 2 free fatty acids and 1 molecule of monoacylglycerol. Hepatic lipase aids in the regeneration of LDL. Colipase is secreted by the pancreas and is an important coenzyme for optimal function of pancreatic lipase. Lingual lipase is a fat-digesting enzyme that is secreted in the saliva and aids in the breakdown of dietary lipids before they are stored in chylomicron form. All of the following large intestine bacteria are considered beneficial except A. Lactobacillus plantarum. B. Streptococcus thermophilus. C. Lactobacillus acidophilus. D. Clostridium difficile. The answer is D. Clostridium difficile. All of the bacterial strains listed have been shown to have beneficial effects on gut and immune health except for Clostridium difficile, a pathogenic bacteria commonly seen in hospital settings after prolonged antibiotic use. Clostridium difficile has been associated with chronic diarrhea, behavioral disorders, and colitis.